Okay, now we have SNAP, and we have Chiquita Lyons and Dallas Edwards, and they are just about to induce general anesthesia and SNAP in preparation for dental x-rays, dental cleaning, and dental exam, an oral exam. So you can see that the catheter is in place, and Miss Chiquita is injecting the anesthetic agent. Inject it very slowly. When we give this medication, we only give it as needed. We give no more or no less than is needed to get the patient in a state where we can continue with the procedure. And you'll see that they're going to give a little bit and wait. They're going to check some blink reflexes. In a minute, Miss Chiquita will try to open SNAP's mouth and see if there's resistance. So it's just a slow procedure. And SNAP's feeling really good right now. We've asked SNAP to start counting from 100 backwards, and we didn't make it very far. I think SNAP made it to about 91, and it got very blurred after that. So now Miss Chiquita is going to check to see if we're ready for induction. Not yet. We saw a little swallow there and a little bit of resistance. So she's going to give a little bit more medicine. And keep in mind too, SNAP was given a pre-anesthetic medication, a cocktail if you will, of meds to reduce anxiety and to sedate SNAP a little. This is called balanced anesthesia, and balanced anesthesia is anesthesia that is using many drugs at very, very small doses, and it makes it very safer, very much safer. And so now Miss Chiquita is satisfied with the depth of anesthesia, and she has an endotracheal tube, and with the help of Miss Dallas, they're going to place this endotracheal tube in SNAP's airway into the trachea. This is called intubation. This doesn't hurt. Of course, SNAP's asleep. And what this does for us, this ensures us an airway at all times, so we can make sure that SNAP can breathe, and we're going to supplement pure oxygen mixed with a gas called isoflurane that will help or will keep SNAP asleep. The isoflurane is very nice in that it's very short acting, so if we need to increase or decrease the depth of anesthesia, we simply just turn the knob on the machine and she breathes more or less of the gas. And remember that SNAP is breathing pure oxygen with about a 3% isoflurane added, so 97% oxygen and 3% isoflurane. Room air is roughly 20% oxygen, so quite a bit. Now you'll see that my very skilled technicians, and by the way, if I were ever to have surgery, I'd rather these girls work on me than anybody, because they are professionals. They know what they're doing. They keep a cool head in a hot situation. They're good. So Miss Dallas is hooking up the EKG, also known as ECG, and it will monitor the electrical rhythm of the heart, so we can monitor arrhythmias and treat them as needed. You'll see Miss Chiquita is putting eye ointment into SNAP's eyes, because the eyes don't close when critters are asleep like this, and we don't want the eyes to dry out. You see that thing, that blue thing in Dallas's right hand? Dallas, would you pick up the egg? There you go. That is a fluid warmer that is warming the IV fluids entering SNAP's body. And this probe that Miss Dallas is hooking up now is a probe that will monitor SNAP's body temperature. SNAP is lying on a device called a chill buster that is a heating pad. Then on top of SNAP, we have a warm water circulating heating pad. And so we really worry about these little critters getting cold, so we constantly monitor their body temperature. That makes anesthesia so much safer. The box hanging on the wall there is an IV fluid pump. It is pumping fluids into SNAP's body at the rate of 40 milliliters per hour. Now what we're going to do is Miss Dallas is going to listen for breath sounds on both sides of SNAP's chest to make sure the tube is placed properly. Miss Chiquita gives a breath and Dallas listens.